person-centered therapy. The key figure and the major focus in this, of course, is Carl Rogers. It's a branch of humanistic psychology that stresses the, approach of, well, as it says, the person being the most important part of the therapy. It developed in the 1940s as a reaction against psychoanalysis. Based on a more subjective view of the human experiences, it emphasizes the client's resources that they have and their ability to become aware and resolve the blocks that are keeping them from personal growth. It puts the client, not the therapist, at the center of the relationship. The basic philosophy is grounded in a positive view of humanity. It sees the person as innately striving toward becoming a fully functional human being. The basic assumption is within the context of the personal relationship with a caring therapist. The client experiences things that are previously denied, experiences the previously distorted feelings, and increases their self-awareness. The client is empowered to become a participant in the therapeutic relationship, and they actualize their potential for growth, wholeness, spontaneity, and inner directedness. The key concept is that one can be the director of one's own life. The client has the capacity for resolving life problems effectively without interpretation and direction from an expert therapist. It really centers on experiencing the present moment, learning to accept yourself, deciding on the ways you're going to change in and of yourself. The goal is to provide a climate of safety and trust in the therapeutic setting so that the client can use the relationship for self-exploration and become aware of these blocks to growth. The client tends to move toward openness, greater self-trust, more willingness to evolve as opposed to being a fixed product, and more living by internal standards as opposed to taking external cues of who we ought to become. Rogers emphasized the attitude and personal characteristic of the therapist and the quality of the client-therapist relationship as what was really going to determine the outcomes of therapy. The qualities of the therapist that determine the relationship include genuineness, non-possessive warmth, accurate empathy, unconditional acceptance and respect for the client, permissiveness, caring, and the communication of those attitudes toward the client. The client is then able to translate his or her learning in therapy outside of that to relationship with others. Because it's based on the client-therapist relationship, it specifies very few techniques. As a matter of fact, their techniques are secondary to the therapist's own attitude and the therapist's ability to get that across. It minimizes directive techniques. As a matter of fact, non-directive therapy is one of the ways it's referred to. It minimizes interpretation, questioning, probing, diagnosis, and collecting history. It really goes into listening and hearing, reflection of those feelings, and clarification to help the client see where the feelings are. The application is really found in person-to-person situations. In both therapy and learning, it's a useful model for individual therapy and group counseling, student-centered teaching and learning, and parent-child relationships. Human relation training labs, things where relationships are key to what you're talking about. The contributions is that it's one of the first therapies to break from traditional psychoanalysis. It stressed the active role and responsibility of the client. And it's positive and has an optimistic view and calls attention to the need to account for a person's inner and subjective experiences. It makes the therapeutic process relationship-centered rather than technique-centered. It focuses on the crucial role of the therapist's attitudes. Limitations is that it's the possible danger is the therapist who, by just reflecting content, doesn't bring any of their own personhood to the therapeutic relationship. It's limited to use. It has limited use with nonverbal clients because, of course, it has a lot to do with reflecting what the client has said. And as an historical approach, it tends to discount the significance of the past. You're living in the moment. You're going on from here. And some of the main limitations are not due to the theory itself, but to the counselor's misunderstanding of the basic techniques. Some of the key terms: accurate empathetic understanding, the act of perceiving the internal frame of reference of another and grasping that person's subjective world. Congruence, the state in which self-experiences are accurately symbolized in the self-concept. Self-actualizing tendency, a growth force within us. That's part of that optimistic view of the human person, that they have within them an ability to move forward and an inner desire. Humanistic psychology, a movement often referred to as the third force that emphasizes freedom, choice, values, growth, self-actualization, becoming, spontaneity, creativity, play, humor. All of those are terms related in any humanistic psychology. And unconditional positive regard. That is, the non-judgmental expression of the fundamental respect for another person as a human. Acceptance of a person's right to his or her feelings, key to the therapeutic relationship. Well, that's what you need to know for person-centered therapy. Good luck on the test.